Let me review few question and answer for NCLEX. First question is here. The nurse is waiting or awaiting the arrival of a client from emergency department. The client has a left ventricular myocardial infarction and is being admitted. So when a patient has a left ventricular myocardial infarction, got emergency department, patient is coming to the ICU or regular unit, how we take care of them and what are the signs and symptoms of the patient left side heart failure or left side myocardial infarction. In caring for this client, the nurse should be alert for which sign and symptom of the left side heart failure. Select all. There are 6 options. You have to find it out which one support the left side heart failure or left side myocardial infarction, like jugular vein distension, hepatomegaly, dyspnea, crackles, tachycardia, and right upper quadrant pain. There are 6 options, right? Let me answer you. Dyspnea, crackles, and tachycardia is the answer. If the patient have a right side heart failure, answer would be jugular vein distension, hepatomegaly, or right upper quadrant pain. Why I am confident? Why I can distinguish these 3 or 4 is right side and this 3 is the left side? Did I memorize them? Answer is no. I try to understand why this is the sign for left side heart failure, why the crackles or dyspnea is a left side heart failure, why jugular vein distension or hepatomegaly is right side heart failure. Why? Let me answer why. So in this picture, you can see this is the heart and there are 4 chambers. Right side heart, left side heart. Right heart collect the blood from all of the body through the superior and inferior vena cava. So right blood come from the body to the right atria, then blood go to the ventricle, right ventricle. From right ventricle, blood supposed to go to the lungs. From lungs, blood supposed to go left atria, from left atria to left ventricle, and left ventricle when diastole, blood expel out to the body. This is the normal happen. But what else? If the failure, if the right side heart failure, what happened? If the left side heart failure, what happened? These arrows or this picture talk about the heart failure. Is not normal heart circulation. When the right side heart failure is occur, increase the pressure and fluid retention or venous congestion or peripheral edema develop on the right side. And like example is the right ventricular heart failure. So blood supposed to go from right ventricle to the lungs, but in case of right heart failure, blood go from right ventricle to aorta. Blood does not go forward. Blood supposed to go back flow, back direction because right heart failure. When blood go back direction from ventricle to right atria, then from right atria, blood go to the back direction towards your right side of the body. Blood come through the right side from lower extremity, from liver, from abdomen, then blood go that direction. Patient develop hepatomegaly, right? And patient develop jugular vein distension. Patient develop right upper quadrant pain because increase the pressure and fluid retention the right side, venous congestion to the right side, and also peripheral edema develop, like edema in the abdomen, edema in the legs, because right side heart failure. Normally, in the left side, what happened? Blood normally side, blood come from lungs to left atria. From left atria, blood supposed to go right left ventricle. From left ventricle, blood supposed to go to the whole over the body through the arch of aorta. But when right side, left side heart failure occur, that times blood does not go to the aorta to the body, blood go retro direction. Retro means backflow. So blood does not go forward from left ventricle to the aorta. Blood supposed to go left ventricle to the left atria. From left atria, blood supposed to go back direction because left heart failure, left myocardial infarction occurred. So from left atria, blood supposed to go to the lungs. When lungs is full of blood, we call congestion. When lungs is full of blood or fluid, patient develop shortness of breath and patient develop the added sound inside the lungs we called crackles. So what happened? Increase the peripheral resistance or myocardial disease, left ventricular failure, and what happened? Increase the pressure and fluid retention in the lungs or pulmonary, and patient develop pulmonary hypertension, and patient develop pulmonary edema, shortness of breath, crackles, right? So now what are the answer here? They said left side heart failure, our question, patient develop dyspnea, crackles, and tachycardia, sign of left side heart failure. The jugular vein distension, hepatomegaly, or right upper quadrant pain is a right ventricular failure. What is their rationale? The sign and symptom of left side heart failure include dyspnea, orthopnea, or paroxysmal nocturnal dyspnea. Dyspnea does mean shortness of breath. Orthopnea, it means patient develop the blood pressure change or shortness of breath when they change the posture or lying down. Or patient develop the paroxysmal nocturnal dyspnea. So when patient is lie down on the bed during the night time, they have developed shortness of breath. Why? Because of the posturing, blood or fluid retention in the lungs and develop the shortness of breath. Or patient feel fatigue because your lungs does not work well. Lungs does not work means less oxygen, oxygen deprivation to the tissue, and metabolism does not take place, develop fatigue. Or non-productive cough, crackles, hemoptysis, cough mixed with blood. Or we can get point of maximum impulse displaced towards the left anterior axillary line. So apex beat diverted towards the left axillary line. Also tachycardia or we can found added heart sound, which is called S3 or S4 heart sound. Sometimes cool, pale skin, but jugular vein distension, hepatomegaly means liver enlargement, or right upper quadrant pain, all of the sign of right-sided heart failure. In this picture, it is showing if patient have a left side heart failure, what happened? Like here, we say passive backflow or transmission to the left side feeding pressure, and left heart loss of compliance, exercise increase regurgitation, systole or diastole dysfunction. So this is the heart, lungs, blood supposed to go from ventricle to the lungs, but blood go back direction. And this is a ventricle, blood supposed to go left ventricle to arch of aorta, but in case of failure, blood supposed to go to the lungs, right? So next question here. The client with venous insufficiency and develop various veins in both legs, varicose vein, varicosity, tortuosity of the veins because of venous insufficiency. Which statement about the varicose vein is accurate? Varicosity. Answer: varicose vein are common in men rather than women. Primary varicose vein are caused by deep vein thrombosis and inflammation, or sclerotherapy is used to cure varicose vein, and the severity of discomfort is not related to the size of varicosities. So let me redo the question. They said your client diagnosed venous insufficiency and developed varicosities in the both legs. Which statement about the varicose vein is most accurate? They said varicose vein are common in men rather than female. Primary varicose vein are caused by deep vein thrombosis and inflammation. Does it make any sense? Or scleroderma is used to cure varicose vein, and also the severity or discomfort is not related to the size of varicosity. So they said answer: the severity of discomfort is not related to the size of varicosity or tortuosity. It is the answer, accurate answer. So why not sclerotherapy is used, or primary varicose vein accurate to deep vein thrombosis, or varicosity is more? So 1 to 3 is not accurate. Why? Let me read the rationale. The client with varicose vein commonly complain itchy or aching, heaviness, pruritus or itching, moderate swelling, and also unsightly appearance of the leg. It does not look good. However, the severity of discomfort is hard to assessment and seems unrelated to the size of varicosities. Varicose vein are more common in the women rather than the man. So it is not true. Varicose vein are more common in man. No, it is more common in the female. The primary varicose vein typically result from congenital or familial predisposition that makes the vein well makes the wall less elastic. So they said it is patient has a family history, patient has a congenital problem, right? So problem with patient carry out during the birth, and their wall is weaker, so vein easily dilated and fluid or blood go there and stay for a longer time and causes the problem. The secondary varicosities occur when patient has trauma, obstruction, deep vein thrombosis, or inflammation damage the valves. Sclerotherapy, in which a sclerosing agent is injected into the vein occur scler agents or injected into the vein is used to treat the varicose vein, but it does not cure them. So it is a management, surgical management, or we go for the sclerotherapy, but it is not, it does not cure the varicose vein. Next question here. A client signed a consent form for participation in a clinical trial for implantable cardioverted defibrillation. Which statement by the client indicate the need for further teaching before the true informed consent can be obtained? So when we go any kind of invasive procedure, always we need their informed consent. So as a RN, we should make sure patient gave the informed consent and doctor should take it. And we will be there as a witness, right? Again, let me redo this question. The clinical trial for implantable cardioverted defibrillator, right? So which statement by the client indicate the need for further teaching? So what patient telling it is something wrong and you need to correct them when you go for informed consent. Number one, they said this implanted defibrillator will protect me against some of those bad rhythm my heart goes into. So there's some medical condition like ventricular dysfunction. We use defibrillators. Patients say, this implanted defibrillator will protect me against some of those bad rhythm. Number two, I wonder if there is any other way to prevent this bad rhythm. Number three, the physician will make a small incision in my chest wall and place generator there, or a wire from generator will be attached to my heart. They said the answer is what is wrong, I need to correct. I wonder if there is any other way to prevent this bad rhythm. So when we use the cardioverted defibrillator to correct the problem in my heart, definitely I have to know, we should take the informed consent. Before take the informed consent, we will explain what are the procedure, what are the advantages, and what are the disadvantages. Right? If patient have any question, we will answer and we will make it clear them first. So why they said number two is the answer? What are the rationale? The client wondering if there is another way to prevent the abnormal rhythm indicate that other treatment option was not discussed with the client. So when a patient is diagnosed a disease, we will explain them what are the different options of the treatment, conservative option or treatment, surgical remove or surgical treatment, or others, right? So second or third option, you need to explain. Now it depends on patient choice, what they do. It is their rights. If they like, they can take the treatment or care. If they do not like, they can refuse it. So when anybody say like this, number two, it means you do not explain what are the alternative way. Before participation in a clinical trial, the client must be informed of all other available treatment option. The other statement about implantable cardioverted defibrillation are all is true. What is true means this implanted defibrillation will protect me against some of those bad rhythm, irregular rhythm, missing rhythm. The physician will make a small incision in my chest or over the heart and will place a device that can help to produce the impulse and make the abnormality to make the normal rhythm. A wire from generator will be attached to my heart. So why this need? When your SN node does not produce the impulse or impulse produced from any other side except SN node, right?